नमस्ते बिटिया, हमेशा खुश रहो बिटिया. Very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Homeopathic Science in JAYOTI VIDYAPEETH Women's University. In today's lecture, we are going to discuss about iron deficiency anemia. Iron deficiency anemia occurs when iron losses or physiological requirement exceeds absorption. There are two important causes of iron deficiency anemia. Number one, increased physiological requirement, and number two, pathological blood loss. Increased physiological requirement and pathological blood loss. Increased physiological requirement occurs in two stages. At the time of growth spurts, at the age of 6 months to 2 years and 11 years to 16 years, and during pregnancy. Pathological blood loss can occur in multiple conditions. The conditions like reproductive system, like menorrhagia. There can be blood loss from the GI tract that we have already discussed in the third year. Dietary losses like vegans in elderly and hookworm manifestations. In the GI tract, there is bleeding, esophagitis, esophageal varices, hiatus hernias, peptic ulcers, malabsorptions, inflammatory bowel disease, hemorrhoids, and carcinoma of stomach. So these are the various causes of bleeding from the GI tract. Esophagitis, esophageal varices, hiatus hernia, peptic ulcers, malabsorption, inflammatory bowel disease, hemorrhoids, and carcinoma of the stomach. Now, the clinical features of iron deficiency anemia. The clinical features are broadly categorized into three features. Number one, manifestations of the underlying conditions. Number two, due to anemia. And number three, due to iron deficiency anemia. The manifestations of the underlying conditions are the pain of peptic ulcers, epigastric lump, and carcinoma of the stomach. Due to anemia, we have easy fatigability, weakness, headache, body ache, inability to concentrate, giddiness, palpitations, exertional dyspnea, angina pain, and congestive heart failure in severe anemia. So due to anemia, there are the features of easy fatigability, weakness, headache, body ache, inability to concentrate, giddiness, palpitations, exertional dyspnea, angina pain, and congestive heart failure in severe anemia. Now, the clinical features due to severe iron deficiency anemia. We have the tongue is smooth and pale. There are features of dysphagia. There is atrophic gastritis like achlorhydria. There can be nail changes like koilonychia. The symptoms of hepatosplenomegaly, that is of mild degree. Pica. Pica is the abnormal craving for indigestible things. And various miscellaneous features like edema of the feet, amenorrhea, increased intracranial tension, parotid gland swelling, hair loss, impairment of the T cell functioning. I will again repeat the features of iron deficiency anemia. The tongue is smooth and pale. There is dysphagia, atrophic gastritis that causes achlorhydria. There can be nail changes like koilonychia, hepatosplenomegaly with mild degree. The features of pica and miscellaneous symptoms like edema of the feet, amenorrhea, increased intracranial tension with parotid gland swelling, hair loss, impairment of the T cell function. There are various investigations that could be done. The investigations includes the history and the physical examination. The history of skin, nails, conjunctiva, mouth, gums, tongue, and serious physical examination has to be done. Full blood count and the blood film examination has to be done. There is various hematinic assays like serum ferritin, vitamin B12, and folate. There is investigation of the urea and electrolyte. Liver function tests have to be done. You have to check for fecal occult blood and also midstream urine and also pelvic ultrasound. So the history and physical examination of the skin, nails, conjunctiva, mouth, gums, tongue and CVS, full blood count and blood film examination, hematinic assays of serum ferritin, vitamin B12 folate, urea and electrolyte, liver function test, fecal occult blood, midstream urine and pelvic ultrasound. The treatment of iron deficiency anemia consists of eradication of the cause. The cause has to be eradicated. Iron therapy that includes oral and parenteral therapies and blood transfusion. So we have to eradicate the cause. Iron supplementation by oral or parenteral route and blood transfusion can be done. In homeopathic treatment, we have a lot of medicines for the treatment of iron deficiency anemia. In homeopathy, we have to prescribe medicine on the basis of constitutional symptoms, but therapeutically also some of the medicines can be given. The medicines includes acetic acid. Acetic acid is adapted to pale, lean persons with legs, flabby muscles. Face is pale, waxy, with hemorrhage from every mucous outlet, like nose, throat, lungs, and stomach. Also bowel and uterus, and it produces the state condition of anemia. Next very important medicine is Calcarea phos. It is indicated for the persons of anemic and dark complexioned, dark hair and eyes, with thin spare subject instead of fat. At puberty, there is acne in the young anemic girls with vertex headache and flatulent dyspepsia that is better by eating. Next important medicine is Ferrum Metallicum. It is indicated in the women who are weak, delicate, chlorotic, and yet have a fiery red face with irritability. Slightest noises like crackling of the paper drives her to despair. Natrum muriaticum. It is indicated for the anemic and cachetic individuals, whether from loss of vital fluids, profuse menses, seminal losses, or mental affections. There is irritability with child cross when kindly spoken to, crying from the slightest cause, and gets into the passion about trifles, especially when consoled with. Next important medicine is picric acid. Picric acid covers the symptoms of neurasthenia with muscular debility. There is progressive pernicious anemia and vertigo and noises in the ear. That is worst by least exertion. Next we have sulfuric acid, in which debility is very marked. There are tremors and weaknesses with right-sided neuralgic headache, compressive pain in the right head, heartburn, and sore eructations. The last one is the Zinc Metallicum. In Zinc Metallicum, it is indicated for the persons who are suffering from cerebral and nervous exhaustions. There is defective vitality, brain or nerve power is wanting, too weak to develop exanthemata and menstrual functions, expectorate, to urinate, to comprehend, and to memorize. So this was all about iron deficiency anemia. In the next lecture, we are going to discuss about megaloblastic anemia. This session was powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. This was all for today. Thank you very much. We will be meeting in the next lecture tomorrow.